Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in April 2023 that we hope might be of interest to the VieSID community. So let's begin. Yildirim et al. Published in Cranio an article evaluating the effects of bruxism on oral health-related quality of life. They considered 315 patients, of which 172 were probable bruxers. These individuals were also evaluated for TMD using the research diagnostic criteria for temporomandibular disorders. The patients were asked to answer their oral health-related quality of life questionnaire. The answers were compared with those of 143 controls who were no bruxers and were free from temporomandibular disorders. The results show that all the bruxers, only 60 were free from TMD, while the rest showed muscle pain, disarrangement, or a combination of both. Bruxers free from TMD showed a significant reduced oral health-related quality of life with respect to the controls in terms of physical pain or psychological disability. The presence of TMD worsened the outcomes. As noted by the authors, a limitation of this article is the assessment of bruxism performed via questionnaire and clinical oral examination rather than by means of polysomnography. In Cranio, we found also a narrative review by Scarmeta et al. On infectious arthritis affecting the TMJ. They aim to discuss the pathophysiology, etiology, and diagnostic features of infectious arthritis with focus on TMJ, which are rare conditions but are associated with high morbidity. The authors scrutinized over 300 articles using the keywords temporomandibular joint disorders, infectious arthritis, septic arthritis, bacterial, fungal, or viral arthritis. They discussed the general characteristics of infectious arthritis, including the dissemination mechanism of infectious agents, the pathophysiology of infectious articular destruction, and the etiology and general features of infections. They went on discussing various types of infectious TMJ conditions, such as bacterial arthritis, gonococcal and non-gonococcal infections, Lyme disease, and reactive arthritis caused by a reaction to a distant mucosal infection derived from the gastrointestinal, genitourinary, or respiratory tracts. Scarmeta et al. Focused also on the clinical diagnosis, including also the synovial fluid analysis, blood tests for markers of infection, and imaging of the TMJ. They then provided information about the recommended treatments for the three main types of TMJ infectious arthritis, the bacterial one, the Lyme disease, and the reactive type. Dental Clinics of North America hosted a special issue on temporomandibular disorders, the current perspective, edited by Thomas and Singer of the Department of Diagnostic Science, Rogers School of Dental Medicine in New Jersey. According to the editors, the rationale behind this special issue was the need to report on the latest advancement in the diagnosis, classification, and management of TMD. In this slide, you can find a list of the topics treated. As you can see, the list is quite complete and includes a review of anatomy, classification and diagnosis, joint imaging, biomechanics of TMJ and arrangement, pathogenesis and differential diagnosis, TMD and occlusion, implication for restorative dentistry, relation to sleep disorders, myofascial disorders, consideration on TMD and the eating experience, and comorbidities. From this table of content, however, it can be noted that some of the authors are recurrent In particular, it is quite odd that the editors themselves appeared not in one, but in multiple publications, also as first authors. Of the 12 articles, Dr. Thomas was the first author of 4 articles and co-author of 1, and Dr. Singer was the first author of 1 and co-author of 2. To my opinion, this fact contributed to the limited perspective on TMD that was provided in this issue, with a strong focus on a biopsychosocial approach. Bartolucci et al. Published a research article in the Journal of Oral Rehabilitation. There is a cross-sectional assessment of TMD prevalence in adults with obstructive sleep apnea. They conducted a cross-sectional control study on a group subjects subjected to polysonography at the snoring section of the ENT department of the Sant'Orsola Malpighi Hospital at the University of Bologna. Patients who receive a diagnosis of obstructive sleep apnea were included in the study group, and the subjects with a negative polysomnography diagnosis were then included in the control group. Both groups underwent examination following the diagnostic criteria for temporomandibular disorders, including Axis 1 and Axis 2 evaluation. 43 obstructive sleep apnea patients that were 29 males and 16 females with a mean age of 52 years, and 53 healthy controls, 25 males, 18 females, and of a mean age of 50 years were included. The authors didn't find significant differences between the study and control groups, regardless of the type of TMD considered. Also, the Axis 2 evaluation did not differ between the groups. The Journal of Oral Rehabilitation publishes usually in the field of temporomandibular disorders, orofacial pain, bruxism, and dysfunctional mastication and swallowing, and related quality of life perspective, and informs in this issue of April that the journal expands the aims and scopes to include research articles and the reviews in the field of physiotherapy and clinical and basic craniofacial neuroscience. The Journal of Oral Rehabilitation published an article by Janez Regonesi et al. On the diagnostic accuracy of the Braxoff, a portable device for sleep bruxism. They tested the device on 49 patients. Each patient was evaluated once over one night, where the Braxoff and polysomnography were performed simultaneously. As you know, the polysomnography is considered the gold standard for the evaluation of sleep activity, including muscle activity and bruxism. The results from the Braxoff were obtained for 42 individuals, as the device failed to record in 7 cases. The detected Braxoff sensitivity and specificity for the diagnosis of bruxism were 83% and 72% respectively, where the cutoff was set at 2 events per hour. If the cutoff was set at 4, the sensitivity dropped to 33% and the specificity increased to 90%. No significant correlation was found between the values recorded by the 2 devices for the rhythmic masticatory muscle activity index and for the total sleep bruxism episodes per night. And the Bland-Hartmann plot revealed a consistent and systematic difference in the measurement of events between devices. Based on the results, the author concluded that the Braxoff is a promising device. I cannot tell whether it could be of use in the clinical settings, but I think it is not up to standards for research purposes. Also, such portable devices cannot distinguish between sleep and awakening phases. Thus, when used not in combination with polysomnography, muscle activity during awakening could be confused with sleep bruxism activity. We have come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.